Do you sleep well and wake up feeling rested? Do you suffer from insomnia? Is sleep truly important for our mental health? Let's delve into these questions today, right here on YoungForeverHealth. Cortisol levels, a hormone produced by the adrenal glands, are naturally higher in the morning because it's crucial for our body's functioning throughout the day. As evening approaches, cortisol levels drop to allow for rest. Conversely, as the day ends and darkness sets in, if a person remains in a dark environment while sleeping, the production of a neurohormone called melatonin increases. Sleep is fundamental for both mental and physical restoration. Melatonin, produced by the pineal gland in our brain, plays a vital role during sleep. Similar to serotonin, melatonin is also synthesized from an amino acid called tryptophan, which can be obtained from foods like nuts, legumes, bananas, brown rice, potatoes, beans, lentils, cashews, avocados, and soy products. Tryptophan transforms into serotonin, which then converts into melatonin. The concentration of serotonin increases in the pineal gland during the day when there is light, in contrast to melatonin. When light enters our eyes and reaches the retina at the back of the eyeball, the optic nerve and its connections transmit this information to the pineal gland, inhibiting melatonin production. The peak production of melatonin typically occurs between 2 and 3 in the morning, assuming a normal lifestyle and a dark environment. The less melatonin present, the poorer the sleep quality, and the poorer the sleep, the greater the fatigue. Melatonin is an anti-free radical substance, making it an antioxidant. It can cross the membrane that protects the brain, allowing it to perform functions within brain cells called neurons. As melatonin levels decline, there can be a simultaneous decrease in brain function. Sleep disorders can also be one of the effects of reduced melatonin with aging. As the pineal gland functions less effectively with age, there's a drop in melatonin production. This often leads to older patients complaining about sleep quality or experiencing insomnia. However, they might also find themselves falling asleep easily during the day when they shouldn't. Have you ever found yourself watching television and drifting off? Sleep is generated by specific brain activities, and certain bodily functions change during sleep. Blood pressure and heart rate decrease. Growth hormone is secreted during stage 4 of non-REM sleep. Body temperature also drops in the later stages of sleep. Sleep is categorized into 2 main types: REM sleep, which stands for rapid eye movement, and non-REM sleep, characterized by non-rapid eye movements. Non-REM sleep is further classified into 4 phases. Most dreaming occurs during the REM sleep period, which accounts for about 20 to 25% of total sleep. Scientists studying sleep at Oxford University reported a study where they selected 4 volunteers who typically slept deeply. They were connected to devices that monitored sleep with high precision. For the first 3 nights, they slept for 8 consecutive hours without any interruptions. However, for the subsequent 3 nights, they only slept for 4 hours, as their sleep was intentionally interrupted by the study team in the laboratory. The team members filled out daily questionnaires to identify any emotional changes and recorded daily videos of the scientific experiment participants. Do you know what the results were? It was observed that there was an increase in anxiety, depression, and stress. There was also an increase in paranoia and feelings of distrust towards others. The scientists were impressed by the fact that only 3 nights of sleep deprivation led to these symptoms. 3 out of the 4 volunteers found the experience unpleasant, but 1 participant claimed not to have been affected and felt fine. However, tests conducted on him revealed that positive feelings significantly decreased after just 2 nights of interrupted sleep, while negative feelings began to increase. In other words, despite his claims of feeling well, signs emerged that his mental health was starting to be negatively impacted after 3 nights of intentionally interrupted sleep for the scientists' experiment. This research, considered the largest controlled study of psychological treatment for mental health, strongly suggests that insomnia can cause mental health problems, rather than simply being a consequence. Daniel Freeman, a professor of clinical psychology at Oxford University who led the study, believes that one of the reasons sleep deprivation is so detrimental to our brains is because it encourages repetitive negative thinking. He stated that we have more negative thoughts when we are sleep deprived, and furthermore, we get stuck in them. He did not, however, claim that a few nights of poor sleep mean a person will develop a mental illness, but rather that the risk indeed increases. Sleeping well protects your mental health. Would you like some tips for better sleep? First, sleep only enough to feel well rested. Staying in bed longer than necessary can make your sleep shallower the following night. Second, Avoid coffee, black tea, cola-type beverages, guarana, and chocolate. Caffeine negatively impacts sleep. Another point, stop smoking. Nicotine can have a stimulating effect and disturb your sleep. Also, engage in daily physical exercise, as it promotes muscle relaxation and contributes to better quality sleep. Seek treatment for sinusitis, rhinitis, or asthma, as these conditions can disrupt sleep by causing frequent nocturnal awakenings. Another helpful tip for better sleep is to maintain regular bedtimes and wake-up times. This helps regulate your biological rhythm. Avoid heavy meals in the evening. It's best if your last meal of the day is consumed at least 2 hours before you go to bed. It's also important to avoid television in the bedroom. I know many people do this, but avoid it. Sounds, light, and temperature can interfere with sleep quality. Your body needs a comfortable temperature, a quiet and dark environment for good sleep. The optimal time for restful sleep is between 9 p.m. and 6 a.m. And one last thing, only use sleep medications under medical supervision. I, Robert Miller, wish you a good night's sleep tonight. I look forward to seeing you next time on Young Forever Health. Peace and light.